Diamond and Di.
Edge Mornings on 102.1 The Edge.
Toronto's alternative.
Penises, testicles, vaginas,
Hooked.
What?
bottoms.
Go on.
Our next guest has been fiddling around with those all his professional life. He is Peter Bray. He is a plastic surgeon. Welcome to 102.1 The Edge, Peter.
Thanks, Dominic. Great to be here.
Sounds great when I say it like that.
What a great intro. That's,
Thank you.
yeah.
So we're here to talk about a number of things. First of all, the thing which is of most interest to me, because I am a man of a certain cup size. Now, male breast reduction surgery is on the increase.
Absolutely.
Wow.
It's a problem that's been with men for decades and decades, but now men are realizing there's actually good solutions that really work.
So if I went to you and said, look at these guys. Right?
Maybe you should turn and face the window.
If I came and said to you, look, I want these puppies down a bit, what would that involve?
Well, you're in great shape, so you got the muscles to back it up.
Thank you.
There we are.
I'm doing a new technique called Body Tight. It's an advanced type of liposuction that allows me to reduce any extra stuff there with a tiny incision out near the underarm.
Would his nipples get worse?
I wasn't aware there was a problem with them.
What's wrong with my nipples?
Nothing.
They're childbearing nipples, Greg.
Nothing.
I've just realised
After kids, everything changes.
I've just pointed my bare nipple at Greg Baharrell twice in the space of 30 seconds. This is an HR thing waiting to happen.
Would that hurt, though, the procedure you just said? Like, if you want to get your breasts reduced, would that hurt the incision thing?
No. A little bit of aching and soreness. A lot of guys describe it as if they had a tough workout at the gym, which of course you're familiar with. And
Wow.
some Advil, Tylenol, and that's about it.
How much would it cost?
It's in the ballpark of $7,000. It's more than pocket change, but for a lot of guys who've been suffering for years and years, it's well worth it.
And you
Very liberating.
just suck out the armpit.
Pretty close.
Wow.
Okay, let's get down to business. I have bad junk. It's like not good. Looks like a Russian tank. So what can I do to it?
Russian tank.
What are my options? What can I do? Can I twist stuff around? Can I extend things?
He wants it bigger?
You know,
Yeah, sure.
there are certainly techniques to do that. I personally don't go there in terms of the male anatomy.
So you're like all the women in Toronto.
Perhaps a talk for another day.
It's too
after
risky,
a few
is
drinks,
it?
maybe.
Is it too risky?
No, there's certain techniques. They do work. They've got their own risks, of course, but just not something I have expertise with or choose to pursue.
Well, my heart's broken.
Yeah. I could probably hook you up with a colleague.
That sounded...
With a guy who really likes working
has
with penises.
expertise in that
Oh,
sort
okay.
of
I thought it
thing,
was a
yeah.
professional who wouldn't judge.
Now, if you're a guy, let's say, and you could do one thing to fix yourself, but you don't have a ton of money, but you want people to notice that you look a little better, what would you do?
Probably good old-fashioned diet and exercise.
Oh,
Sorry to say.
No. Come on, just anything else other than the
Come on,
boring
man.
stuff?
Don't be lazy.
Come on.
You know,
What plastic surgery can we get?
men suffer or go through the aging process just like anyone else. So in terms of bang for your buck, quick changes, Botox and injectable fillers are terrific. Now, it doesn't have to be the sort of thing you see on the Housewives of Vancouver, where
Right.
everyone looks like an alien freak. Tasteful, balanced, conservative things work really well.
So, like, where would a guy get the Botox?
The angry lines here between the eyebrows, forehead lines, also the little creases, the crow's feet are terrific. More and more men selfies, they're becoming aware, hey, I don't look so great in this light, and coming in to get a little tweak.
My favorite is Bray to Housewives. Go back home, aliens.
Yes.
That's great.
Do you find there's a lot of these techniques that women used to get done in the past that now more and more men are getting done instead?
Yeah, absolutely. And, Botox and injectable fillers are a good example, but also good medical grade skincare can make a big difference. And
Butts?
yes,
Men are getting butts done now?
they are.
Really?
What?
Yeah.
Take a look at this.
Why would a guy get their butt done? I don't get it.
It's usually men who've lost a ton of weight. They've either had weight loss surgery or they've really been working hard to lose it, and everything deflates and flattens, and they're looking to have some shape and proportion back.
Yep.
Have you heard of that beard transplant?
Yeah.
So what is that all about?
Transplanting hair from one place to another, finding a place where it's growing, moving it to a place where it isn't. Hair transplantation's come a long way in the last few years. It's very sophisticated now.
Okay, can we just nail you down when you say a place where it's not growing and you take hair from a place that's growing? I'm a man who's bald, but I've got hairy balls. For example.
Awesome.
Delicate.
Would you transplant them from that area? Because I've got a lot to spare.
It's a different kind of hair, and
Okay.
it wouldn't work nice.
So what areas are you talking about then?
So for men, it's areas along the sides and the back. They often continue to grow, even though other places have lost a bit. Yeah.
Okay.
Wow, eh? Oh, man. So you're not going to look at us and say, hey, I'd fix this, I'd fix that, are you?
I don't think any of you need my help.
Oh, come on.
Look at Greg's head.
You're really good at lying. Are you sure you shouldn't be a lawyer?
No, the proper thing is to sit down for a good half an hour, talk about the options. Having a good understanding of what's available is really the key. Some people are keen to really go for something big and long-lasting. Others just
I thought you said you didn't work with penises.
You're not going to let that up, are you?
What is the most common procedure for a male? Is it the breast reduction?
It is in my practice, yeah. It's really increased over the last couple of years. The other areas, what I call the male trifecta, would be chest, love handles, and a bit from the tummy. Using body-tight liposuction. It's terrific. It works on those areas that can be really hard to tone down through regular diet and exercise. They can be really stubborn.
Wow.
We'll be back with some of your questions for Dr. Peter Bray in a tune or two's time right here, 102.1 The Edge. 416-870-EDGE for your calls. We've also put something on Facebook and Twitter.
Diamond and Dye.
Edge Mornings.
On The Edge.
We are here with Dr. Peter Bray, a cosmetic plastic surgeon. It's just like glory hour here at The Edge. The calls are coming in like crazy. People want to know what they can get done, how much it's going to cost, and how much it's going to hurt. I mean, we live in that kind of world. It's 2014, right? On the phone with us right now, we have Kelly. Kelly, you have hair in an unwanted place.
Yeah.
Where is that hair?
I have to mind my language, so I'm going to say it's on my buttocks area.
So, Dr. Bray, what are we going to do about the hair on the buttocks?
Well, first of all, don't feel bad. It's such a common thing, having hair in that place and just about everywhere else for some people.
Tell me about it.
Yeah.
Sounds like a rope ladder.
There's great options these days with laser hair removal, and any number of places will do a quality job of that. My two offices, Elements downtown and also the Bel Air Laser Center, very popular, very effective, and minimal downtime. It's terrific.
But how much does it cost to get rid of the hair on your bum?
It depends how dense it is and how many treatments. It's going to be multiple treatments for most guys, and probably a couple of $100 per treatment. So
Well, I can tell you right now, it's like a forest down there. So if I can do about 20 treatments.
Kelly, but we don't care. The ladies don't care unless you're going to be a nude model. Are you going to be a nude model?
No.
So why are you just, is this like does your woman care about it?
Yeah, it's kind of ugly.
Oh, okay.
Well, best plan is to visit a reputable laser hair removal center, have a consultation, get a proper estimate, including the number of sessions, and expect to pay, a couple $100 per session, and maybe requiring 7 to 10 of those.
Oh.
But it works.
So a hedge trimmer wouldn't cut it?
Oh, it certainly would, but it might cut something else you'd regret.
And remember, lasers are a lot more precise than they were on the Death Star, so it's not quite like that.
Very true. I'm not going to trust somebody with a hedge trimmer on myself. So.
No.
Good plan. Good plan.
All right, thanks very much for your call, Kelly.
No problem. I love
Chelsea Kathleen
Sorry, Kelly.
got in touch via Facebook to ask, is there surgery to make your feet smaller?
There is kind of. It's not something that would be done by a plastic surgeon. It would typically be an orthopedic surgeon, and very rarely would that be done in Canada. It's kind of been frowned upon, but there are places that can do it or help to remove the bumpy parts that you might not like.
Wow.
We have Dion on the phone. Dion is concerned about breasts, but not his breasts, somebody else's breasts. Dion?
Hi, how's it going?
Awesome. Go ahead.
I'm a boob guy. I'm sick and tired of girls being like, oh, I need breast reduction, blah, blah, blah. Do you get sad to see a nice pair of puppies go?
It's always about making the client happy. And I'd have to say breast reduction for women who are really suffering from back pain is probably one of the most satisfying procedures that I would do. They are delighted. Their significant others, well, that's a negotiation they have to have.
Well, it's a negotiation. I have to say, Dion, that I've been going through with my wife for many years. My wife is a substantial woman up there, and she has said for years that, especially after 3 kids, she wants to have a breast reduction. I beg her, I plead her, I'm on my knees saying no. But I think it's something she really wants to do because of the back pain. I've offered to hold up her back for the rest of her life just so she can keep them.
Now that's commitment.
Yeah. I didn't say what I'm holding up her back with, but you know.
Dion, thanks so much, man.
All right, no problem.
Here's another interesting one from Jeremy Everett. Has a plastic surgeon ever had to look a patient in the eye and say, oh no, you really should not get that done? How often does that happen?
It's fairly frequent, and these days a lot of people are doing their own research and coming up with the idea that, hey, I think this would be a great thing for me. And after having the discussion, realizing that is not the procedure that's going to do what you want. And then it really comes down to expectations management. I'm not interested in performing a procedure if it's not going to satisfy someone's goals.
What can I do to be hot? Like, take a look.
I think I don't know, you're pretty
No,
good
the
that
forehead's garbage. Let's just be honest. So what do I cut the scalp off, or what is it? How does it?
No, you need that. You got to keep that. Yeah.
How can I?
You're talking about changing your forehead line?
Anything.
Let's talk about the forehead line, because that's a...
Yeah. My forehead's garbage.
Well, the easiest way to make your forehead look shorter is thickening up the hair.
What if I move my eyebrows up?
That would satisfy one goal, but compromise another. You'd look permanently surprised.
That could be fun.
I think I'm I'm a 4 now. Could you make me a 6?
I think you're a good 5.5 already. Don't sell yourself short.
Aw. Thanks, Doc.
One final quick question is coming on Facebook. Can you take boob fat and put it directly into someone's butt? So you would use the same fat you would take it for a boob reduction and put it down there.
Fat removed from anywhere with gentle liposuction can be transferred just about anywhere else in the same person. So the answer to that is yes. That wouldn't be a common arrangement. But of course, it really depends on the person and what they're trying to achieve. Have to have a sit-down evaluation and see if that's going to do what they want.
Do people ever ask for really, really bizarre things? Greg, for example, has just said about wanting to do something with his forehead. Do you ever get people who say, give me a breast on my forehead or something really bizarre?
There's bizarre questions, all right. Never had that one.
Just freestyling.
Yeah, no, absolutely. There's some interesting requests.
Can you tell us what the most bizarre request is?
Well, there was one young man who asked if I could insert glass beads under the skin of a certain body part.
Oh!
Wow.
And I don't even have one.
So, needless to say, I politely declined my services.
Oh,
wow.
That's great. Well, listen, we'd love to have you come on again and have a chat with us again, Peter.
Oh, great to be here. I'd love to.
We can examine ourselves a bit more thoroughly now. We've got a basic knowledge and we'll really go to town.
Love it. Thank you so much.
Great to
Thank
be
you.
here.
Thank you. Dr. Peter Bray, plastic surgeon.
And the other guy, Greg Barrel.
On 102.1 The Edge, Toronto's alternative.